Sagar Shah of the American Planning Association's Planning and Community Health Center. Thank you.
Good afternoon. Thank you to National Academies for inviting me to talk on planning and public health. I think I'm the oddball a little bit here in terms of background, so I'm very happy to share my experience and the work that we do at American Planning Association with you guys. And we have been talking about cross-sectoral partnership forever, right? So it's good that we are here together. So what I'll do is before I talk about my work and a little bit about APA, I'll talk about the connection between planning and public health. Many of you may know, some of you may not know. So I'll start there and then talk about some of the projects that we are working on. We all have seen this map, right? It was created in 1854. This shows the connection between planning and public health. And in fact, I mean, if you look at the historical nexus, planning and public health were the same by the end of 19th century. They were even called blood cousins with common ancestry. So everything was together. At the beginning of 19th century, we started going away from each other. Public health people started focusing on moved away from engineering-based solutions to like people-based approach and initiatives, and planners started focusing on cities and communities, making them beautiful, making tree-lined avenues, etc. So that's where the divergence happens, and it kept happening till I think 1960s, 1980s. However, they started coming together, both the fields, in 80s, especially in 90s with the Healthy Cities movement, which started in Europe, which emphasized the importance of social determinants of health. And since the beginning of this century, we have been doing pretty good job in terms of working hand in hand. However, there are always room for improvement. So I'm glad that I'm here and talking about planning and health. So what are the domains through which planners can influence public health or create healthy communities? We know that almost 70, 80, but there are different numbers out there, of public health is determined by aspects or factors beyond healthcare, right? So, for example, active living. Planners play an important role in order to see that communities, neighborhoods are walkable or auto-dependent, whatever. So we play an important role in terms of that people have good level of physical activity. Food systems, access to healthy food is important. Planners play an important role in terms of locating land uses, zoning, etc. I think I'm missing. Anyway, so social cohesion, right? Social cohesion is very important for mental health, stress. Planners play an important role in creating public spaces, that inclusive public spaces that can help, that can increase chance encounters so that people can talk, mingle, increase the social capital in the community. I think my animation is not working well. So one other aspect is emergency preparedness. We know that this is National Academy of Sciences. We can say that humans play an important role in climate change. Climate influences health. And when it comes to climate change, the carbon emissions from automobile is one of the major factor in creating climate change. And planners play an important role in terms of whether we have a sprawl development or we have compact development, right? So that's another way that we influence. Another factor is emergency preparedness and community development. So the various ways that we can collaborate together to influence public health. And I'm only talking about like built environment. I'm not even going into other social determinants of health beyond built environment. So these are just the connections between planning and public health from the lens of built environment. And each of these domains that I talked about can be further divided into subdomains. So active living, we are talking about active transportation, which is going from one place to another with a purpose, right? And then there is active recreation, where people are going to parks, etc., to do to walk, jog, etc. And then there is traffic safety elements. So there are various domains in this larger domains that planners can influence. So a little bit about APA, just a couple of sentences. We are membership organization for planners. We are the largest membership organization for planners in the world. We have, what we do is we advocate excellence in planning, promote education and citizen empowerment. We have about 43,000 plus members coming from all states and territories. We have 47 chapters, one for each state, and there are a couple of them that are clubbed together in Northeast. So we have representation from each state, similar to like APHA has affiliates in each state, and organizations have that. We also have 21 divisions that are the groups of people coming together to talk and work on specific issues. We have divisions for sustainability, transportation, economic development, etc. We also have like 7 interest groups, which interest groups are something that are made before something becomes formalized division. And we have healthy communities collaborative interest group that we are very involved with actually. And it has, as of now, informally we have like 750 members, out of which more than half are public health professionals involved in it. So it's amazing group. People talk about cross-sector collaboration all the time. How can we work together in space, in placemaking? So I manage the Planning and Community Health Center. We have, at APA, we have like a Center for Planning, and we have 3 flagship programs. Planning and Community Health is one of the program in that center. And what we do is we provide tools and training to our members to integrate health into their practice at all levels. And our members, as you may already know, they work at various levels of government. Most of them are working with local government and private sector, but we also have a representation of planners working at regional level, state level, and even federal level. So these are the examples of some of the projects that we have worked on. As you can see, we have worked on various range of issues, from creating healthy neighborhoods, working on health HIE toolkits from the perspective of planners, like what is the role of planners in HIEs, benefit of street scale features. Traditionally, we have focused on access to access to healthy food, and then access to physical activity locations. But in last couple of years, we have been trying to diversify and focus more on emerging issues such as the impact of climate change and health, and the role of planners in that. How can gentrification how does gentrification affect health, and how can planner play a role in housing policy, etc. So we have been, and you will in coming years you will see more materials on those type of topics. So what we work on, how we work on, we use 3 mechanisms. Generally, all our projects can fall into these 3 categories. The first one is applied research. So what we review the academic literature and the gray literature, and then create reports, tools, etc. for our members. Here is an example of a project we work on, healthy plan making, where we do qualitative analysis of how planners can integrate health into their plan making process. This is an example of project that we worked on. Another type of mechanism we used is place-based work. Plan for Health is one of our flagship program in this particular type of mechanism, where we funded 35 communities. So we funded the coalitions, which were comprised of at least a representative from public health field, a representative from planning field, and a community-based organization. We funded 35 of those coalitions throughout the country to help them either work on access to food or access to physical activity locations. And then training and education, we create, again, for example, the webinar toolkits, etc. for our members. We did a 3-part series webinar last year on planning and opioid epidemics. So planners play an important role in terms of NIMBYism, location of methadone clinics, group homes, etc. Those legal issues related to land use zoning play an important role in opioid epidemics. So we had a series on that, where we invited professors and academicians from public health school to talk and educate us on the issue. Example, a couple of projects we are working right now. We work on like very broad scale projects, such as the first one, where we are trying to integrate health and equity into comprehensive plans. We are working with Health Impact Project, and we have representatives from PU and RWJF here who are involved with HIP. we're helping 3 communities integrate health and equity into their comprehensive plans. They're in the process of updating them, and we are trying to help them through a mechanism and framework to integrate health and equity. So it's like broader perspective, city level plan. Another project is basic site-based project that we are working on. So we are trying to create educational modules to help planners cite EC facilities, which is early care and education facilities in disaster-affected areas, but taking into consideration that they don't get negative impacts from environment, such as polluted air, water, soil, etc. So we are working with National Environmental Health Association and CDC on this project. We work with a lot of partners. We work with national membership organizations. We work with federal agencies. We work with foundations, universities, local-based organizations. And important part is whatever partnership we develop, most of the, I would say 99% of the time is cross-sectoral. So we are we much value the importance of cross-sectoral collaboration and always open to working with diverse group. And I'm very, very glad that I get to meet a lot of you guys here I can already see future projects coming up, so that's nice. Last slide, I would like to highlight a couple of things. I think I already talked about Healthy Communities Collaborative Interest Group. I would like to highlight the joint call to action to promote healthy communities. This is a joint call to action where 8 national organizations working at the intersection of built environment and health have come together to help our local members, affiliates, chapters, etc., to come together in their own communities to talk about health and cross-sectoral partnership. So we have AIA architects, we have planners, we have public health, APHA, we have civil engineers, we have NRPA, park and rec people, we have ULI, which is real estate developers, we have landscape architects, and we have Green Building Council. It's an amazing effort. We are trying to do like a strategic planning in terms of where the group should go and what we can do. And excited about what is going to come out of this. So I think this is the last slide. I just would like to say that being part of this workshop has been really educative, informative for me, especially getting to know a lot of the other aspects of public health and population health. It seems like we have always worked with local public health departments and not beyond that. So maybe there are so many opportunities to work with community health workers, with nurses, with physicians, with hospitals, etc. In the future. So I'm very positive about this collaboration. Thank you.